heart in Kawasaki disease during the acute phase, and then we're going to have a break. We want you to write down your questions. We're going to have some runners, yes, going up and down the aisle collecting those. And then in the next session, we're going to address the issues of long-term complications of the heart. So Jeff is really talking about the heart during the acute phase and in children, and then we'll have our adult cardiologist after the break. Thank you, Jeff.
Okay, does this work? Great. Okay, can you, no? Maybe I'll just hold it. All right, well, thank you for that introduction, Jane, and thank you all for coming to this. I really applaud you. I think that it really says a lot about your commitment to this disease and your children to take time out of your Saturday morning to come to a conference. I also want to thank Jane for inviting me to give this talk, and I think you know, we don't get a lot of opportunities to publicly thank our coworkers, and I just want to publicly thank Jane for all that she does. She's really an example of an excellent clinician that is really dedicated to her patients, and an excellent researcher, and an excellent person. And so I just want to say thank you, Jane, publicly. For everything that Jane does. All right, well, so when I started thinking about what I wanted to talk about today, I tried to put myself in your shoes and think about what is it like when you find out that your child is going to have Kawasaki's disease. I think maybe it's something like this. If you're not screaming at us externally, you certainly might be screaming at us on the inside. It also might be something like this, feel something like this. Ouch. Yeah, maybe. And little did you know, but you were taking a dive into the deep end with us, and that dive is not always perfectly smooth. Ouch, again, right? Okay. And you're going for a long adventure together. So I often tell my families that you know, once you have Kawasaki's disease, you're kind of in the family again. You're, it's like the mob, you know, once you're in. So welcome brothers and sisters, I guess. Huh? And so from my side of things, when I walk into a room to see a family with Kawasaki's disease, I'm always thinking that, you know, this is, I think of this cartoon, this is from The Far Side, this is a Gary Larson cartoon, and the top pane there, for those of you that can't read it, says, what we say to dogs. It says, okay, Ginger, I've had it. You stay out of the garbage. Understand, Ginger? Stay out of the garbage or else. And the bottom pane says, what dogs hear? Blah, 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 Ginger, blah, 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 Ginger, blah, blah, blah. And I think maybe when we come into the room and talk to you about Kawasaki's disease and how it can affect the heart, I think you guys might hear blah, 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 heart, blah, 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 coronary arteries, and that can be kind of scary. And so I want to try and demystify the heart for you a little bit today, and hopefully give you some perspective on things. And what I'm going to really concentrate on, there's a multitude of things you can talk about related to the heart and Kawasaki's disease, and I'm going to really just concentrate on the coronary arteries and talk a little bit about the long-term recommendations and our long-term follow-up that we do in the pediatric cardiology clinic. So I'm going to briefly talk about what the coronary arteries are, what their anatomy is, and how they work, and then how they're affected in Kawasaki's disease. All right, so what the heck are these coronary arteries? So these are blood vessels that arise off of the aorta, and I know this, a lot of you know this, but just to make sure we're all on the same page here. These are blood vessels that arise off of the aorta, and their job is to supply blood to the heart. So when our heart pumps blood, it goes out to the tissue takes the oxygen out of the blood and gives up the stuff that it doesn't need, the carbon dioxide, and that's exactly what the coronary arteries do, except they supply the heart. So obviously that's very important. If there's some compromise of blood flow into the heart, there can be problems getting, having the heart work well. So, and there's anatomy. I'm going to show you a picture in a second, but there's a right and a left coronary artery. The right coronary artery supplies, as you'd expect, the right side of the heart, and the right side of the heart pumps the blood out to the lungs, and the left coronary artery supplies the left side of the heart, and that side's responsible for pumping blood out to the body. So here's a little diagram. And I use this because I wanted to feel a little bit like Vanna White, so here, without the evening dress. So anyway, these are the coronary arteries. This is the right coronary artery here, and this is the left coronary artery. The left coronary artery splits into an artery called the left circumflex coronary artery that goes around the back of the heart, and then the left anterior descending coronary artery. And these little branches here, all of these branch off into smaller branches and smaller branches until there is a place where the oxygen can be exchanged at the capillary level. This is a little animation of sort of, oops. This is a little animation of sort of what I just talked about, and there you can see the right and the left coronary arteries with the heart intact. The pulmonary artery is sitting right here, and this is the aorta. And if I let this play a little bit more, they'll take away the rest of the heart, and there's the coronary arteries being attached to the aorta. Okay? Now, when the heart is pumping, oh, here we go. Blood gets pumped out of the heart into the aorta, and then blood flows into the coronary arteries to supply the heart muscle. So how does Kawasaki's disease affect the coronary arteries? Well, there's sort of acute effects that include dilation and aneurysm formation, among other things, and then there's longer-term effects, and I'll touch a little bit on both of those things. So this is another animation. This is an animation that Jane put together with the Kawasaki's Foundation, and you're going to see the heart beating here, and we're going to start out by looking at a coronary artery that is going to look a little inflamed. Okay, and we're going to actually go inside that coronary artery. Inside the coronary artery, you can see that there's red blood cells and white blood cells, and then there's this layer down here that is the endothelium. So this is the wall of the blood vessel, and this should be sort of a barrier to the blood leaking out of the wall. But in Kawasaki's disease, there's some stimuli that causes the endothelium to allow white blood cells to cross the endothelial layer into the wall of the blood vessel. And these white blood cells come into the blood vessel, and then they release mediators, including TNF-alpha, that you just heard about, and many others. And these mediators sort of ramp up the inflammatory response in the wall of the blood vessel. And that inflammatory response can damage the blood vessel and can cause increasing fibrosis and other changes to the blood vessel. Those changes can cause the blood vessel to become somewhat weaker, and it can dilate, and this blood vessel is a little bit dilated when you compare it to the blood vessels on the side here. Okay. Now, giving IVIG before 10 days of the onset of fever can prevent this, but not exclusively. And we have many patients, unfortunately, that receive IVIG in a timely fashion and still have dilation of the coronary arteries. Now, if it's just dilation, a lot of times that dilation goes away and the coronary artery kind of goes back to normal again. But in a certain subset of patients, the coronary artery becomes aneurysmal. And this is an example of an aneurysm. And here you can see the coronary artery sort of balloons out and gets very, very dilated. Now we're going to look at the internal flow of the coronary artery. So here you can see this is the lumen on the inside of the coronary artery and the blood flow of the blood through the coronary artery. And this is an example of an aneurysm. Okay? And what you're going to see here is that the blood, when it's flowing normally, it kind of flows in a uniform fashion. All the blood is moving at the same speed. However, when there is an aneurysm, you'll see these little eddies or swirls as I let this play here. And those are sort of non-uniform flow of blood. And that can predispose you to thrombosis and clot formation. And here you're going to see over here a clot is going to form. And this is how you can get a clot or a thrombus or get a heart attack in the early part of the disease. Then there are chronic changes that occur with the coronary artery. So you'll see that the blood flow now is going in this direction. There's still some eddies. And then there's some fibrosis that starts to occur. And that fibrosis causes is done so that is produced by the body so that the blood flow goes back to kind of how it should be. So the coronary artery sort of straightens itself out again. Okay, so that seems like a good thing, right? But too much of a good thing can be a bad thing, and that is what can happen late in Kawasaki's disease, is that this fibrous tissue can kind of start to stick out into the lumen of the blood vessel, narrow the blood vessel, and lead to heart attack later. So just to recap all that, so there's some inflammation that occurs in the coronary artery wall that leads to damage of the coronary artery wall. That can lead to dilation or aneurysm formation. In the acute phase or the early phase of the illness, that can lead to thrombus or clot formation. and later it can lead to some fibrosis.